Welcome to the ResearchWorks podcast, broadcasting live from the Oceania Academy of Cerebral Palsy and Other Childhood Onset Disabilities Conference 2026 in the beautiful city of Hobart, Australia. Join Dr. Dana Poole and the ResearchWorks team as we bring you an exclusive series of interviews with visionary keynote speakers and leading presenters, captured right here amid the groundbreaking discussions and innovations shaping the future of disability research and care.
Welcome back, everyone. We're here at the Oceania Academy Conference 2026, Hobart Tasmania, Australia. And we are continuing our quest to speak to as many people as possible about some great papers that are being presented here at the conference. And today, first time on the show, but I do know about both of you, Hayley Sheedy and Chrissie Macdonald. Welcome to the pod.
Thank you for having us.
It's fabulous, Dana. We're very excited to be here.
So good to have you here. I'm really looking forward to speaking with you about your papers. There's two papers here that we're going to discuss. Seems rather ambitious to discuss two papers, but they're both quite related and there's a wonderful history behind it. So let me just go through the titles first just to set the scene. The first one is Cerebral Palsy, Temporal Trends in Birth Prevalence in Australia, 1995 to 2018. And the second one is titled Epidemiology of People with Cerebral Palsy and Significant Support Needs, GMFCS 4 and 5 in Australia. So both really important pieces of work. Hayley, can I start with you with regards to the register? Like the register is something that we've all heard about, we know about, something that you're intimately involved with.
Yep.
What's the history there?
So you've got me on my passion topic. So absolutely love the registers. The most important thing I think to remember about the registers is that it's a collaboration. So it's a collaboration of registers from across each state and territory that all contribute de-identified data to a national collaboration, the Australian Cerebral Palsy Register. It was established in 2008 and there's enormous camaraderie and enthusiasm from the researchers across each state and territory that contribute, and it brings together a big cohort of children with CP and lets us track changes in trends over time, in prevalence rates over time. And that's really important because we know that there are changes in medical care, there are socio-demographic changes, and understanding how those impact on prevalence rates of cerebral palsy is really important.
I can see the passion and enthusiasm there. It's wonderful. And I was going to ask you the follow-up question, but you already knew what I was going to ask you. Like, why is it important? So it's sensitive enough to pick up changes and trends over years of work. That's actually possible.
So we have this huge, wonderful, rich history of registers in Australia. So in Victoria and Western Australia, they've had registers from the 70s and 80s, and they can track changes in those states from all the way up to now, which is amazing. And the Australian Cerebral Palsy Register, our data goes back to 1995.
Wow.
So it's just a real privilege to work with this group.
I bet it is, because I think once you have a register that's so involved, like I've been to some of the meetings before, I'm involved in the West Australian one, and it's so lovely to have been asked. I was like, yes, of course I'll join. Yay. And when you join the meetings and you have people of all walks of life that are passionate about cerebral palsy, because, I'm a physiotherapist. Yes. I approach it from this perspective, but there are a lot of people involved. Can you maybe just give us a rundown of who's involved, what kind of health professionals?
So in most states and territories, there's a huge collaboration between the researchers, and in Western Australia, it'd be like Linda Watson and Michelle, for example. And they have collaborations with medical professionals who help notify that there are families or children with CP that could be included on the register. Basically, each group works with their local, usually tertiary hospital, to help collect data on CP. Yeah.
And it's a huge effort, isn't it, to make sure that data is being collected at the right time.
Yep.
And then entered. What kind of data is being collected? And I know this is going to get you excited already. I can tell by your eyes.
I know.
What's collected?
I know. So we collect birth demographic data. We collect data about people's CP, like their type and topography of cerebral palsy, their comorbidities. And this is collected usually from administrative data sets like medical records, etc. And the I guess the amount of work that goes into collecting that data just really can't be underestimated. It takes hours and hours to collect each record. And then what happens is when the children reach 5 years of age, the data is all confirmed. So we go back and check that the current data is accurate and still reflects that child's clinical profile. So for some children, a very small minority, they may no longer have a CP description. It may no longer be relevant for them. And so they would, there may be a choice of whether they like to stay on the register or not if they're receiving CP-type services and would like to know about research in CP, but they wouldn't be counted in the prevalence data.
I see. So how interesting is that then? So you would be able to collect data on, or you'll be able to see the trends in changes in medical practice. I imagine changes in funding structures. It would be such a source of information for advocacy as well.
Yeah.
Is that?
Well, we have a really strong community reference group, Aboriginal Torres Strait Islander Community Reference Group, and we do take a lot of advice from them about how we communicate our findings and the most appropriate way to share what they think are the most important messages that come out of the research. So, it's a really rich group and collaboration between researchers, health, and all the medical professionals who are so generous in their support of the registers and people with lived experience and the community. So, it's a joy to work on.
Oh, what a privilege, isn't it? Sometimes the things that we get to do. It's such a privilege. It really, really is. Yeah.
And it's been so exciting because there's registers in Australia who are doing, I think the Australian Register has made some really important contributions, and all the state and territory registers, including the three long-standing ones, South Australia, Victoria and WA. But then beyond Australia, we have collaborations with the surveillance of cerebral palsy in Europe, and now the absolutely amazing Global Low Middle Income CP Register, which has countless countries included now. And that's led by Ishrat and Ghulam Kandaka. And they are a powerhouse. Ishrat Jahan and Ghulam are just a powerhouse between the two of them. And, so getting to collaborate across those three networks, have these international collaborations, it's just a joy.
It really is, isn't it? I remember seeing them every conference I go to, you see the map of who's now included, and it just spreads in the most positive way.
It's an absolute explosion of registers and the work that's being done, because a lot of the registers will have a research intervention arm, so there'll be early intervention rolling out attached to the CP register itself. So it's a very exciting time.
And that's such an advantage in a way of having a register that's newly established, is that you can set up those structures to collect that data from the beginning.
Absolutely.
Yeah, brilliant. Before we get into the results there, you mentioned about the consumer reference groups. Chrissie, I know you're really involved with that part of it. Do you mind just giving us some context around that?
So there are several different consumer reference groups, but specifically for our project, when we were looking at we started looking at the group with more severe cerebral palsy and decided that we needed a reference group to help really guide the discussions and the priority setting for research and advocacy and services in that space. And so with the tremendous help of CP Quest, we were able to pull together a reference group of people with lived experience of cerebral palsy and GMFCS 4 and 5. And so that group has named themselves a 5-star rated group, which is a really brilliant name. And
love it.
It's fabulous. And one of the first things they did was discuss their preferences for terminology, because we know that how that is described within the literature isn't necessarily really strengths-based, and they've come up with significant support needs as their preferred terminology. And so you'll see that through our project.
Support needs. That's so wonderful, because it gives you that confidence. We're all actually speaking the same language, and that the work that we're doing is collaborative and it is actually appropriate as well, isn't it? Can you give me some examples of what significant support needs was referred to previously?
Yeah, definitely. So when one of the first things I had to do was kind of look through the literature and try and find what was out there, and even just being able to do the search with all the different terminologies. Often it will be called severe, high support needs, references to GMFCS levels, which, working in the field we're all familiar with, but aren't necessarily familiar to all other medical professionals or, people in the community.
Yeah.
So when we were discussing what was out there, some of the people with lived experience in the reference group started brainstorming what they use at home, what they like and what they don't like about each of them. And I think it's important to acknowledge that this is the preferred terminology of our reference group and not necessarily everyone.
Of course.
But yeah, for our group, significant support needs was what they felt comfortable with.
That's the value of the consumer reference groups, isn't it? Yeah. Absolutely.
Absolutely.
Yeah.
And I think what they really wanted to highlight was that with significant support, they could live full lives.
Love that.
And so that's why they chose that terminology. Yeah.
How wonderful and so insightful, and I do love that term. Like, even with just 3 words, you can always already see what support might be required, and whether that's funding, whether it's equipment. There's so much advocacy in just those 3 words. Yeah. Okay, thank you for giving us that background, because I think it's really important for everyone to know about, the register is not just a collection of data and numbers. It lives and breathes, isn't it? And it informs. So Hayley, in this particular paper that you are presenting at conference this week, do you want to tell us a little bit about what the main goal was of this one?
So we really key role of a cerebral palsy register that has population ascertainment, like we do with the Australian Cerebral Palsy Register, is to provide contemporary data on trends and prevalence rates. Okay. So we used the most recent data available, and it included up to 9,286, I think, children in this particular analysis. It allowed us to look at data from 1995 up to 2018. And whilst that might seem a little while ago, 2018, we have to wait till children turn 5 to confirm their data.
Sure.
And then there's usually a little year of cleaning data, and then we're ready. That's why there's a little lag there. So what we did was we looked at the prevalence rates over time in 2-year epochs, and we looked at prevalence by 1,000 live births for pre-perinatally acquired cerebral palsy, and by 10,000 live births for postnatally acquired cerebral palsy. And we did regression analyses to look at whether there was a significant trend and an increase or a decrease over time. And then when we could see there might be a little uptick in some places, we did join point regression to look at whether that time point had an increase. Yeah. So that's what we did in this study. Yeah.
Fabulous. It's like on a touch screen. You had a look at it and then you zoomed in.
Exactly. Because sometimes linear regression doesn't tell you everything. It just tells you whether there was, on that slope, was that slope significant or not on a graph. But it doesn't tell you if there's a change at some point, whether that was an important change or not. Yeah.
Fabulous. So this is a lot of data as you go through all of it. So what were your findings?
So our findings were that for cerebral palsy overall during this period, we had a significant decline, as much as 40% over this 40%. Period of time. Yeah, so it's really an important finding. We've seen a very large decline over the last 20 years in prevalence of cerebral palsy. That this was also significant for pre-perinatally acquired cerebral palsy, which makes up 94% of the total group. We did not see changes in the postneonatal CP. There was no significant change in rates. But there's a lot of work going on in that area, which I could bore you with for hours.
Doubt you bore me.
But that's another piece. And then the other piece of what we did in this study was we looked at the rates by gestational age group.
Okay.
So less than 28 weeks
Right. So we can actually be that granular to look at that period of time too.
32 to 36 and 37 above. And across all the gestational age groups, we had declines, and they were significant for all groups except for the 32 to 36 week group.
Ooh, any thoughts about why?
So the sort of question we have around that is that there are amazing interventions for your less than 28-week group that work on reducing intraventricular hemorrhage and white matter injury. Wonderful NICU interventions now. And for the term group, you have therapeutic hypothermia for HIE, for example.
Yes.
And we're just wondering whether there's a little care gap there for 32, 36 weeks. They're definitely getting benefits of both those potential improvements in antenatal care, maternal care, obstetric care. But is there potential?
More targeted.
It could more be done for this 32 to 36 week group. So we'd really love to talk with clinicians about their ideas and suggestions about opportunities for prevention in that group. Yep.
And I love how that's so specific, isn't it? To be able to look at that, because you've got this overall decline. I mean, 40% is quite a wild number, really. Yeah. In really quite a short period of time.
Yeah. It's a credit to the, changes in, as I say, maternal neonatal care. Shout out to all the clinicians and clinician researchers out there who've made this a reality. And also probably just socio-demographic changes as well, I think, probably have impacted. But with cerebral palsy prevention or reduction in rates, it's unlikely to be a one change in care. It's lots and lots and lots of little changes that accumulate to create a situation when you have the healthiest possible pregnancies and the best possible care for babies.
I can't help but to reflect on, we talk a lot about implementation science at the moment, right? And what an example of implementation across so many different sectors and professions all coming together in that short period of time. That is a wonderful example.
Yeah. And I think a big shout out to ANZNN as well, who do such amazing work on refining the work they do with those tiniest of babies that come through, and just the spirit of that network that is constantly trying to improve outcomes for that group is really impressive. Yeah.
So wonderful. What an exciting time to be in the field and to know that these changes are possible. It provides so much hope, doesn't it? And so part of that register as well, so when you zoom in even more, Chrissie, over to you now. We're looking really specifically at what in your title for significant support needs, so GMFs 4 and 5. Why did you want to look into this one specifically?
So as Hayley said, we know that overall the prevalence of cerebral palsy in Australia is reducing over recent decades, but we didn't know if that was the same for those with GMFCS 4 and 5, those significant support need groups. And so when we took this to the reference group, it was felt by them that it was something really important to investigate further and that they wanted to know about. So hence the project, one of many projects. But
yeah. So the goal in this was to look very specifically within this population. Or did you look at the same data range, or was it more specific?
Yeah, so our birth years that we were looking at were 2001 to 2018.
Okay.
So a slightly more contemporary look, and but again, still using the same data set, and isolating it to those who were confirmed identities of GMFCS 4 and 5 in the register.
Sure. Yeah. Okay. And then let me look at the numbers. Yeah. There were huge numbers in yours as well, weren't they? Yeah. Okay, so what was included?
Yeah, so we set out to really kind of look at two main aims. The first was to report on the trends in prevalence. And so I'm definitely a novice in the epi space, and I'm going to really dumb it down. It's for people like me.
She's being modest.
I'm a physio by background. And so we're really talking about the number of babies born in Australia who go on to have cerebral palsy with a GMFCS level of 4 or 5. And we're looking at, those trends in how many babies are born. And so our first aim was to report on that.
Okay.
And then our second aim was to look at co-occurring conditions. And again, that's terminology pulled from our research partners.
Yes.
So we're looking at the proportions of those people who are GMFCS or have a level of 4 or 5 who have severe co-occurring conditions.
Right.
And so the information we can pull from the CP registers are around hearing and vision impairment, speech impairment, presence of epilepsy and intellectual disability.
Right. So how is that data collected, and how is, for example, vision impairment, is that a confirmed CVI, hearing? How's that collected, just from my understanding?
Yeah. A really great question. And it was something that I had no idea going into all of these projects. And what I've learned is that each CP register probably has a slightly different coding system or definitions, but there are booklets or manuals that define what each level would be. And when you're putting it into the database, it's really like a number, and each number is associated with a level of impairment. So
and we take the data from the medical records, and all communication with families, as well.
Yes.
So
it's not a yes or a no. They have a vision impairment. There's a level that is described.
Yes, but it's fairly blunt.
Yes. Sure.
So there'll be, could be wears glasses like myself, or it could be, significant vision impairment.
I see.
Yeah,
I see.
or no impairment.
I see.
So
okay.
it's fairly blunt measurement, because when you're collecting data on every child in Australia with cerebral palsy, we have to keep it very simple.
Of course.
But nevertheless, even with a very simple information, you do get quite good data.
Yeah.
Of course. You collect a picture, a clinical picture, don't you?
Yeah. And it really tells a story of the person.
It does.
But the information, it might be data points, but one of my take-homes was like, this is really, when you start pulling it all together, you really get a story about the person behind it.
Yeah.
Yeah. So,
especially with this many data points as well.
Yeah.
Okay. So what did you find?
Yeah. So, so when we looked at the prevalence rates, we were able to start with combining GMFCS level 4 and 5 together.
Sure.
And we found that overall there was a 50% decline.
50% decline over that period of time.
2001 to 2018.
Wow. Okay.
So then what we did was we looked at that group further, so that microscope further into gestational age groups.
Right.
And this is where it gets a little bit more complex, and you're talking about much smaller numbers with much wider confidence intervals.
Okay.
So when Shona presents the abstract, you'll be able to see on the graphs that most of the gestational ages appear to have a decline. Especially the under 28 weekers, but none of them reached statistical significance.
Okay.
Under 28 weekers was just not. But so because those confidence intervals are quite wide, we weren't able to say that the decline was statistically significant.
Okay.
When we then went and pulled them out further, so we looked at GMFCS 4 separately to 5, we were able to see in the 4s there was a 40% decline, and that reached statistical significance.
Right.
And then in the 5s, we saw a similar decline, but because of the statistical analysis and the confidence intervals, we couldn't say that it was statistically significant.
Okay.
But it was, I think from memory, a 50% decline, but it didn't quite meet statistical significance.
The numbers are too small.
Yeah.
Yep.
Yeah, sure. By the time you pull it out into the gestational, of course.
And that was always...
And we're already looking at 4s and 5s specifically,
But when you see them together, you see it is statistically significant, and there is that 50% decline.
And I guess this is why the collaboration of registers is so important.
Yeah, absolutely.
Because trying to do that with one state, there has been some excellent research done in single states as well, but bringing it together, you have so much more power to be able to look at the small subgroups. And, what you might potentially do, what we've done with other groups, is even collaborate with another network, for instance, the Cerebral Palsy Surveillance Program in Europe, where we've looked at congenital anomalies and shown a Goldsmith's work on that. By bringing together, really large population, you can then look at these very, very little subgroups. Yeah.
You see the epidemiologist and you just bursting out there. Large data. Yeah, which is fabulous. Okay, so that's a significant life-changing decline there when it comes to people's significant support needs. What about the co-occurring?
Yeah.
Yeah.
So what we were able to tell with the co-occurring conditions is that they are across the board common in this group of people with cerebral palsy, and sort of high level when we compared the proportions in GMFCS level 4 compared to 5, they are more common in those with GMFCS level 5, which makes
reflects
sense.
What we often see clinically. Yes.
Yeah. And so I'm going to preempt, but when we were talking with our reference group, 3 of the members, and it's probably just a good time to give a shout out to Sarah Ann and Mary and Diana, who partnered with us on this project particularly.
Yes.
Like their involvement was essential from the beginning. But when we're starting to look at this information and interpret it and figure out what are we communicating and what does this mean for the CP community, this is where their involvement was essential.
I bet.
Yeah.
And what did they say?
Yeah. And so what they really wanted to pull out was like, we acknowledge that there is this decline in the number of babies born with CP who go on to have GMFCS level 4 or 5, but the health complexities remain. Yeah. And more than ever, it's the time that we need to have a really good focus on maternal and neonatal care, ongoing education and services to support this group of people to be able to live full lives in the community and have full community participation.
That's such an important message because cerebral palsy, we know, very heterogeneous. We know there's overall declines, but there still needs to be, I'm very passionate about working with this group of children. We know that it's an area where there probably hasn't been enough interventions that have been developed, but it just shows that there needs to be a focused attention to this group. And that's what I take out of it as a clinician is go, wow, this work is so important. The advocacy in this area is even more significant because the support needs are much higher as well. What are your thoughts and final take-homes that you'd like everyone to make sure they remember and talk about maybe in their practice?
You want to start, Hayley?
I guess I just probably want to say that, we had nearly 10,000 children in the CP registered data that we've talked about today. And, remembering that those children and families require ongoing support and intervention and care to ensure that those children can participate fully in life and have a wonderful life experience. I think this is just probably the take-home message, that, and keep working with families whenever you can.
I love that. That's brilliant. Chrissie, one from you?
Yeah, I think I've got 2. I think reflected in the keynote speakers that we heard yesterday and in the pre-conference workshops that I got to attend, that how essential consumer involvement in research, meaningful consumer involvement in research is. And we're so very, very grateful for the work that CP Quest do with us. And probably also like a little plug for the CP registers as a new
good. Do it. Yes.
Like this, they are essential in being able to report on these trends. And I think that they're probably something as a clinician, something I didn't appreciate, the level of work and effort and collaboration that goes into them.
It really is, isn't it? And I look forward to the publications every 2 years and the short ones that come out. It's fabulous. I always make sure I've got my latest copy as well.
Very good.
So yes, I'm a huge fan, and I've got lots of ideas, which I'll talk to you off air about.
Oh, actually, could I say one more thing?
Yes,
I just wanted to give a shout out to all the researchers across Australia working on the CP registers and the custodian organisations that support them, because, it's a weird thing, but CP registers aren't sexy like other bits of research, and it's really hard to get funding. And so we so appreciate the support that we have from these custodian organisations, including Cerebral Palsy Alliance, who make the Australian Cerebral Palsy Register possible.
It's absolutely true, isn't it? Because, I think on the flip side, without it, if we didn't have it, where would we be?
We wouldn't know what's happening.
That's right. There's no way of measuring any of the interventions, any of the investments that have been put into the area of research. So good final plug there. Thanks, Hayley. I hope everyone enjoyed that. That was just a fabulous conversation. And do take a look at the registers. It is really... It's fascinating when you look at the numbers, but it also tells you a great story about what the collective community is doing in research and how it's actually been implemented. So it's really inspiring. Thank you so much for joining.
Thanks so much for having us.
Thank you. Talk to you all again really soon. Bye.